Hello, beautiful people. You are live on a brand new episode of Ladyz Digest, where issues in the world of women are discussed. Ladyz Digest is proudly brought to you by AAU TV, the voice of higher education in Africa. And in today's episode, we'll be treating a condition known as interstitial cystitis. As many as 90% of people with this condition are women. And about 3% to 6% of an adult woman has a form of interstitial cystitis. And this condition has a long-lasting impact on the quality of life. You want to know more on this topic? Stay with me as we digest this issue. I'm Joan Iyoha. Dr. Kwadwo Owusu Ansah has been a practicing doctor for 17 years, 14 of them as a gynecologist and obstetrician. He is also a fellow of the West African College of Surgeons. He has since successfully helped several women achieve their dreams of becoming mothers through various assisted conception techniques, the oldest of them being a 59-year-old. His hobbies are weight and aerobic training. Welcome back to Ladyz Digest, and if you just join in, you can join the conversation on our social media handles on Facebook and YouTube at the Association of African Universities, and on our Instagram handle at Ladyz Digest. And we have in our guest our able doctor, our resource person, Dr. Kwadwo Owusu Ansah, to help us with this topic. Welcome, Doc.
Thank you.
How has your weekend been?
Oh, it's been good.
Yeah, and a bit restful, I guess.
I hope so.
Oh, okay. I like that. Welcome again.
Thank
and we're
you,
happy
thank
to
you.
have you here. Today we'll be treating the interstitial cystitis. I hope I pronounce it well.
Cystitis.
Cystitis. I see. Okay. Thank you for the correction. Yeah, so per the introduction I gave earlier on, it says that 90% of people with the interstitial cystitis are women. And within 3% to 60% of adult women have some form of this condition. And it has a long-lasting impact on the quality of life. So as I would always start the conversation, I would want you to help us with a very lay definition or a lay introduction of this condition.
Okay. Well, interstitial cystitis refers to a chronic bladder problem, which usually the most pertinent symptom is pain. That can be either intermittent or continuous for a minimum of about 6 weeks duration.
Wow.
Yeah.
Wow. So when you say bladder, it has to do with the urinary
Yes, so the
system.
urinary system. So usually you have the kidneys on top, the ureter, which will link the kidneys to the bladder.
Okay.
The bladder itself, which stores urine temporarily for some hours, and then to the urethra and then down to the genital.
Okay. So I would want you to help us with how a normal maybe urinary system works and how this kind of interrupts it.
Well, the normal system is the kidneys will produce urine.
Okay.
And the urine will go through the ureters, which are connected to the kidneys, to the bladder.
Okay.
The bladder will store the urine temporarily. So it has a total volume of approximately 400 mils. So around half of that, maybe 200, 250 mils, you get the first urge to pass urine. So it will store urine till it's convenient or technically appropriate to let go. And then it will pass the urine. For those who have the pain, usually the pain would either be intermittent or continuous, worsen when the bladder is filling up, or may worsen when the bladder is emptying. So the biggest symptoms are the pain. They do also have what we call frequency of urine, where they pass urine more often than not. So the average person with adequate fluid intake, you are looking at passing urine during daytime about 7 times, and at night, nothing or at least once.
The average.
When that goes beyond, then we'll call that increased frequency. They may also have urgency, where when you feel the urge, you have to rush to the bathroom. So those are the main symptoms of the cystitis.
Does it have any relationship, or is it in any way related to the urinary tract infection, the UTI?
Well, Most often they get evaluated and diagnosed as UTI.
Okay.
So
okay.
usually, and only the diagnosis is quite difficult to get. It may take months or even years
Okay.
to arrive at this diagnosis. And most often they would have had one or two clinicians treat them for recurrent UTI or multiple UTI episodes.
Oh, okay. So it's kind of a sub of the UTI.
It's not a sub, it's something different on its own.
On its own, okay.
But it tends to be mistaken as a UTI.
As a
UTI,
okay, and treated as such. I see. Okay, so there are two different things,
yes,
and should be treated as two different things. Okay,
yeah.
So we want to talk about some things that trigger this condition. So yeah, we'll be talking about the causes. What are some of the things that trigger this condition?
The exact cause we still don't know till today, but there are a few theories. There's one about having little ulcers or sores in the bladder.
Ulcer.
Yes.
I see.
There's one about having repeated infections earlier on in the past, which sort of scars the bladder tissue.
Even when the infections have been treated.
Exactly. So repeated infections and scars the tissue.
Okay.
There's one about having autoimmune diseases, which affects the bladder itself, and some have allergy reaction. So it's hard to say what exactly causes
the exact cause of it. I see. Okay, then we should. I think we should. But okay, per the introduction I gave, it's predominant with women, kind of.
Yes, both genders are affected, but there's a very overwhelming predominance of women.
Women. So why that? Is there any research on? Has there been any research on that too?
It's quite hard to say, but then that's what we've noticed, that there's an overwhelming majority of the people who suffer from this are women.
Women. Hey, that's serious, right? Okay, then we want to talk about some of the risk factors associated with this condition or with this disorder. What are some risk factors that can come out of it?
What we've noticed that there's sometimes is the alcohol intake, maybe some are caffeine.
Okay.
Some people chocolate, some people citrus fruits, some people spicy food.
I see.
Some people carbonated drinks, fizzy drinks. Those are things that are predisposed.
Yeah.
So it so we consider them as maybe risk or maybe predisposing factors.
Oh, I see.
Exactly.
Okay. Okay. So predisposing. So well then we'll talk about that when we talk about treatment. When we're talking about the alcoholic drinks and all that. So we'll go for a quick break. So this has been Ladyz Digest. If you just joined in, you can catch us up on our social media handles at Ladyz Digest on Instagram and on Facebook and YouTube, Association of African Universities. We'll be right back. You're welcome back to Ladyz Digest. If you just joined in, you can always catch us up on our social media handles. And we've been talking about interstitial cystitis, and we've treated we defined it and talked about the symptoms and the causes, which our doctor told us that you can't really pinpoint on a particular cause of it. And we also talked about the risk factors. So we'll go ahead to talk about the diagnosis. So stay tuned. Welcome back, Doc.
Thank you.
Yeah, so we know normally when there's an issue or there's a disorder, you go to the hospital. And if I should come to you as someone suffering from this disorder with pains in my bladder and all, how would you go about, first of all, investigating in terms of questions that you ask, and also in terms of diagnosis, your series of tests that will be done?
Okay. So it's very difficult for the patient to walk in here and say, I have this.
I see.
It's not likely. Usually, it becomes one of the symptoms. The most pertinent of them will be the pain, or some people describe it as pressure. Constant pressure over the bladder area, which may be either consistent or goes and comes. For I would say minimum of 6 weeks, usually that's the minimum timeline. So when you come, usually the questions will be to know when the pain comes.
Okay.
any associations, whether when you're passing urine or whether it's persistent or intermittent, anything that makes it worse, anything that makes it better. And if there are any other associated as in urinary symptoms, as in having urgency, having increased frequency, all that, yes.
Okay.
So once that history is taken, usually proceed to do an examination.
Okay.
And usually they will come when there's comes to a point where it's in sort of degrees, so there's mild, moderate, severe.
Okay.
You have people who have got the stage where it disturbs their social life, their work life, everything. That's when usually they will seek help. Some people also have that, but it's very mild, so probably wouldn't pay much attention to it. So on examination, you're really looking at just the abdominal exam over maybe tenderness over the suprapubic area.
Okay.
You may do a pelvic exam for the woman or a rectal exam if it's a man. So I should make sure there are no prostate problems associated with it as well. So usually getting to the bottom and diagnosing will require eliminating other things like a urinary tract infection, eliminating, let's say, bladder stone, all that, before you settle on this one.
Okay.
That is why they tend to get diagnosed with something else way before you end up finding
the exact thing.
So usually after that they will proceed to do maybe a urine routine examination, which is usually the most simplest of tests. So you get people with pain symptoms or pressure symptoms, and consistently the urinary routine examination test comes out clean, no sign of infection whatsoever. But the pain is still there.
It's still there.
Exactly. So classically that's how they present. And then when they may go on to do what we call the cystoscopy, where you use minimally invasive techniques to go to the bladder and look at the bladder architecture as well as the inner lining.
Okay.
Maybe they'll pick up the little sores, then maybe take a biopsy to see what the problem is. They may also do what we call urodynamics, where they feel the bladder and then let it sort of release it out. So we see the function with regards to
if it's functioning properly.
How it feels and how it functions or releases urine and all that. So that may also do that as well. And then they may do ultrasound scans if they think there are other, maybe like a stone, or maybe check for residual volume of urine as well.
Wow.
So those are the things that you do to diagnose. But there's no one specific test that will diagnose interstitial cystitis.
Yeah, so it depends on if maybe one, when you try one, it doesn't work, you have to move to another, you know.
Not that, it was a whole range of, notice that I said that you have to eliminate other things first.
So it's when,
before you get to this one.
Get to that one,
But usually when they present, usually top of the list, most people will think, oh, it must be an infection.
That's it.
So they may be treated with antibiotics for a long time, and in spite of all the antibiotics, several types, symptoms still persist. And usually that's the first cue to look beyond the usual infection.
So let's say, for instance, someone doesn't go, most times they are like side effects of like a long-term, if it, let's say, it lasts for long, just the way I think when we talked about the polycystic ovarian syndrome, and there are some complications, or there are usually some complications. Are there complications in this one, and what it can lead? Yeah.
Usually, it's the biggest effect is on their quality of life. With regard to work life, social life. So unless they are coexisting issues, usually, and some people over time also become worse. So they move from mild symptoms to very severe, bothersome symptoms.
Yeah.
So the biggest thing is on their quality of life.
So when you say quality of life, or the social life, you mean maybe
the pain becomes very persistent, very disturbing, and then now almost always you have pain.
And you can't go out, you can't feel,
from your work to your social life to everything. And sometimes even intimacy.
That's very true. That's very true. Yeah, because I think in sexual intercourse it can affect that.
So it can also affect them over time if the pain becomes worse.
I see. So can this condition be treated? First of all.
Yes, it can be managed. We tend not to know what actually causes it. And in the management, the approach is it's a case-by-case basis. So usually the first hurdle is to get it diagnosed. And you probably would need, the best person to evaluate this would be a urologist. Who deal with the urinary tract system.
Okay.
And they will be the best person to diagnose and manage this as well. But usually most other doctors will see for repeated urinary tract infection, treat and go. So once you get diagnosed, there's always, depending on the severity of the symptoms, there's always a plan to try and get yours fixed. It could range from lifestyle changes, where once you notice what your triggers are in terms of maybe what triggers your pain in terms of diet or liquid intake, or maybe I mentioned some other.
Yeah, carbonated
exactly.
drinks.
So if you find out that any of these is causing it, they may make you eliminate it from your diet. They may move on to where they use medication to try and control the bladder function and the pain as well. Yeah. And then depending on the severity, when they do the cystoscopy, so they may use the same process to treat any ulcers they may find as well.
So no form of like surgery, or there's no...
For the extreme case, surgery may come in.
Wow, okay.
Depending on the severity. So it's a case by case, but it's hard to predict or prescribe one approach to everything. Some people, when they just make a few changes, lifestyle and a few, maybe 1 or 2 medications, they get complete remission and they are fine for a while. And usually once you are fine, we recommend you continue whatever changes that you made for some time.
So is there a tendency of it recurring?
Yes, it can come.
Oh, okay. So it's not like some conditions, I think once it's treated, it's...
Remember, some mentioned that some of the underlying factors might be autoimmune.
Yeah. So
it depends on what is causing it. Sometimes you may just have to learn to live with it over time.
That's true. We are already rounding up. Per the research, I saw that it affects, I think, women within the age of 40, which I think most conditions is usually the reproductive age. But this is there a reason why it goes? They are more at risk. I think that was what I said.
Usually beyond that age. Sometimes for that, that's the terminal age end of the reproductive.
More like the menopausal.
Not yet.
Okay, not yet.
But at that point, most of them maybe have 1 or 2 or 3 children. So the pregnancy and the delivery process also has its effect on the urinary system and mechanisms to some degree. So that may probably set the stage for further worsening of symptoms if they did have pre-existing issues.
I see. Well, thank you very much for honoring our invitation again, and we are really grateful and we appreciate. This has been Ladyz Digest. You can always go back, watch the show in case you just joined in. Till I come your way next time, I'm Joan Iyoha, and many thanks to my production team who made this production a possibility. Bye.